Okay, hi everybody. My name is Mary Jerome. I'm the Director of Medical Communication and Education at the MMRF, the Multiple Myeloma Research Foundation. I'm happy to be here today, and I want to talk to you quickly about three things. First, we're going to talk a little bit about some steps that every patient can take to be able to achieve their best outcomes in myeloma. I'm going to talk a little bit about clinical trials in myeloma, why they're so important, and how you might be able to find the clinical trial that would be appropriate for you at your stage of your disease. And also we'll talk about resources that are available for you, resources of information and services that you might need as a myeloma patient. So first I'm going to talk about the right track. This is something that our founder, Kathy Juicy, who is a myeloma patient herself, has been working on at Harvard Business School in the Craft Precision Medicine Accelerator, and she's been working with a number of other cancer organizations, namely Pancreatic Cancer Organization, Metastatic Breast Cancer, Prostate Cancer, and Longevity. So those 5 cancer organizations together have been working together to determine what steps every cancer patient might take to achieve the best outcomes in their disease. And so they have decided on these steps here that you can see, and it's called the right track. So it's really important to find the right team, have the right testing done, and then be on the right treatment. And then, of course, sharing what you're going through and sharing your data at every step. So we're going to go through these steps quickly here. So importantly, it's really, it's vital to find the right team of doctors and care team when you're a myeloma patient, especially with myeloma, because myeloma is not a very prevalent disease. It's not very widespread in the community. So it's important to find a specialist who can diagnose you, somebody who treats a high volume of myeloma patients every year. There's definitely certain places where you can find these myeloma specialists. Here at the MMRF, we work with a Multiple Myeloma Research Consortium, which is a group of 25 leading academic centers that treat myeloma patients, and a lot of great doctors and care teams there. We also recommend, if you can't get to one of our MMRC sites, going to a site that is an NCI designated cancer center or some other high volume cancer center, and seeing a hematologist oncologist to help you diagnose your disease and then make sure that you're doing the things that you should be doing to achieve the best outcomes. And of course, we do recommend a second opinion. That's always a good idea, to talk to more than one doctor. Now, once you have been diagnosed, it's really important to have the right testing done because each person's myeloma is different. So it's important to do all the testing possible that's necessary to completely define the subtype of your myeloma. And in our COMPASS study, we determined that there's at least 12 different subtypes of myeloma. So it's important to have all the necessary testing done, and that includes genomic testing. As Dr. Kumar was pointing out, there are trials now where you can be placed in a clinical trial based on your genomic sequencing. So that's another important test for you to have done. And if someone offers that to you, we would recommend that you would have that testing done. All this appropriate testing can help determine the best treatment for you, which can then lead to the best outcome. And then, of course, there's getting on the right treatment. So once your disease has been defined as well as it possibly can be, it's important to discuss your treatment goals with your care teams. Some patients really want to hit their disease really hard and just make sure that the myeloma cells are going to be eradicated, and they don't care much about side effects, whereas other patients would really like to have a more gentle approach and make sure that they still have a good quality of life while their myeloma is being treated. So it's really important to discuss those treatment goals with your care team. It's important to know all the treatment options that are available at each stage of your disease because that helps you have productive conversations with your care team. And then, depending on your diagnosis and the stage of your disease, a clinical trial might be your best option, and we'll talk about that more in a little bit. So, and then the last part of the right track is sharing your information at every step. So we believe at the MMRF that it's really important for every patient to raise their hand and get involved in myeloma and in the myeloma community, because donating your experience and donating your data to the community can help you and other patients like you by accelerating research. And the more data that's collected by all of the researchers and doctors in the myeloma community and pooled together, the more answers that the community can provide and the faster we'll be able to move this disease forward toward a cure.